The third largest outbreak in history of the deadly Marburg virus was sparked by a single jump of the pathogen from an animal to humans, preliminary genomic evidence shows. The outbreak began last month in Rwanda, where it has infected 63 people, of whom 15 have died. Other evidence suggests that the first person to become infected in the outbreak probably contracted the disease during a visit to a cave that hosts a species of bat known to harbor the virus. Multiple introductions from animals to humans would have raised fears that the virus is more widespread in Rwanda than was previously thought. Multiple introductions could also have raised the prospect of new outbreaks, as could an unknown provenance for the virus. Deadly Marburg virus, scientists race to test vaccines in outbreak. Rwanda's response to the virus has also kept the outbreak from being even worse, researchers say. Scientists praise the country's efforts to control the outbreak, investigate its origins and share data with the scientific community. As soon as they realized it was a problem, they started contact tracing, conducted a thorough epidemiological investigation, identified the first patient and potentially the source of the infection, and managed to roll out an experimental vaccine trial within a week, says Angela Rasmussen, a virologist at the University of Saskatchewan in Saskatoon, Canada. This shows that, with the Marburg virus disease, a rapid urgent response can mitigate severity of the outbreak, she adds. The findings, which have not yet been published in full or peer-reviewed, were posted on the social media platform X and discussed at a media briefing on 20th of October. Quick containment. The outbreak, which was declared on 27th of September, is Rwanda's first. Tanzania and Equatorial Guinea recorded their first Marburg outbreaks last year, and Ghana's first was in 2022. Outbreaks of Marburg, which causes high fever, severe diarrhea, nausea and vomiting, and in severe cases, bleeding from the nose or gums, now occur about once a year. Before the 2020s, they were detected at most a few times each decade. Since the outbreak began, reports of new infections have dropped off notably. Rwandan health officials have recorded one new case and no deaths in the past 10 days, and only 2 people remain in isolation and treatment. A Marburg outbreak can be declared over when no new cases have been reported for 42 consecutive days. Lethal Marburg virus is on the rise in Rwanda. Why scientists are worried. There is no proven vaccine or treatment for infections with the virus, which is closely related to Ebola virus, both in its symptoms and in its transmission, which is primarily through contact with bodily fluids. Health officials are offering a candidate vaccine, made by the Sabin Vaccine Institute in Washington, D.C., to the contacts of infected individuals. More than 1,200 doses have been administered so far. This outbreak has one of the lowest fatality rates, about 24% on record for Marburg. Previous outbreaks reported fatality rates as high as 90%. This is probably a result of there being quick diagnoses, access to medical care, and that most infections are in relatively young healthcare workers. In fact, 2 people who were infected with the virus and put on life support were successfully intubated and later extubated as they recovered. This marks the first time that people with Marburg virus disease have been extubated in Africa, Tedros Adhanom Ghebreyesus, Director General of the World Health Organization in Geneva, Switzerland, said at a briefing on 20th of October. These patients would have died in previous outbreaks, he said. Single source. To help inform outbreak control, researchers at the Rwanda Biomedical Center in Kigali sequenced the Marburg virus genome of several infected people. They found that all samples closely resembled one another, suggesting that the virus spread rapidly in a short period of time and that they shared a common origin. They also found that the virus strain is closely related to one detected in Uganda in 2014 and to one found in bats in 2009, Yvonne Butera, Rwanda's Minister of State for Health, who co-led the research, tells Nature.